Today's webinar, we're going to be looking at how LifeQI can support you and your organisation to document your work relating to PSIRF. So I would like to kind of caveat and note now that this isn't a webinar on the ins and outs of the framework itself, because I am absolutely by no means an expert, but it's more around how LifeQI can be used to help document your patient safety incident response profile, those ongoing safety actions, as well as help capture the specific improvement projects relating to these. So today we're going to be focusing on two main areas. Now, the first one we're going to be looking at is how we can use LifeQI to document our journey of implementing the PSIRF framework and capturing those key priorities that we may find within our organisation, as well as how we can use LifeQI to track projects relating to those patient safety incidents. So the first thing I'm going to do is I'm going to come into LifeQI and we're going to have a look at how we can use LifeQI to document our implementation process of PSIRF. So what we've got here is we're actually using the program functionality. Now, this is a really good way to house projects relating to one specific theme. And the way we're using this program here is using the driver diagram to help us document our key priorities and what we might do with those areas, as well as then being able to link projects specific to those key priority areas and how we might be implementing those across the organisation. So a little bit of kind of general layout here. We can see that we can give it our title and our aim of this one is obviously to implement our patient safety incident response framework, and that is a bit of a mouthful. And then along here, we're going to first look at kind of our driver diagram and how we've used our driver diagram within this program to help document our implementation of PSIRF. Excuse my internet, I'll just take a second to load. So what you're going to notice here is the way that I have used the driver diagram in this example is we have the primary drivers here, which are showing our main trust priorities. So these are the priorities that we have identified for our safety incidents. Then along here, we then have what these may relate to. So for example, pressure ulcers that are developed while in organisations' care, inpatient falls resulting in major bone breaks, etc., etc. And then how we're actually going to tackle these. So on the change ideas, we can see that we're going to tackle these by local improvement or organisation-wide improvement. So this is really going to help you outline those key priorities, as I mentioned, what safety incidents these priorities relate to, and then how these may be responded to. What we can then do within our program is that we can then create individual projects which can be a detailed documentation of how that specific priority is being looked at, areas for change, and also include measures and charts to ensure kind of that data-driven approach. I've just seen that I might be coming in and out of audio. Is that happening for anyone else, or can you all hear me clearly?
Sound okay to me, Sophie?
Okay.
So as the other panelist, I'll keep an eye to see if anyone else.
Perfect.
Having said, okay.
Great.
Might just be a local issue for.
Amazing.
Joe.
Fabulous. So I'll carry on. Okay. So as I mentioned here, this is kind of the diagram we can look to track everything that we want to be looking at within kind of PSIRF in one place. And we're now going to have a look at what an individual project relating to one of those priority areas may look like within this program. So I'm going to jump over to the projects area on my program here. We can now see that I've got 4 individual projects relating to the different priority areas that I've highlighted on my driver diagram. So if we jump into one of these and see kind of how we can utilize that. So within this project, which was linked to my overarching program, I am focusing here on my priority 4, which is my deteriorating patient. And the way that I'm going to be using this project is I'm going to be using it to track how we as an organisation are going to be helping with this patient safety incident, so this priority that we've outlined. So we have at the bottom kind of a way to show our aim and our rationale, why we might be doing that. And then in the same way that we did for the overarching program, we can use the driver diagram to really kind of drill down and say what we're going to do relating to this priority here. So we can see that our primary drivers, we're going to be focusing on observations, information, and critical care outreach. And then early warning systems, monitoring plans, and then also how we might implement these. So what change might we want to do across the whole organisation to help with our priority of deteriorating patients? Now, within this project as well, you can absolutely create a main outcome measure as an example. So you could be tracking the data of whether you are seeing change within this priority of deteriorating patient. You can also run PDSAs relating to this project, and that can document what might be happening in localized areas, or it could also be documenting what you are doing as an organization as a whole. So that's kind of just a really quick overview of how you can do this for your whole organization. And as I said, it's really going to help you document that patient safety incident response profile, how you are responding to these priorities, what your priorities are. And it's also going to help you have that data-driven approach and really understand how you are doing against each of these priority levels. Now, not only can we see this at an organizational level and document your whole process and help you understand how you're implementing it and where you're implementing it, we can also be able to track individual quality improvement projects relating to these areas. So let's just jump into a project here. And so one of our priorities we saw at the overarching program level was falls. That's one of the priority areas we're going to be looking at. So we can encourage our localized teams or our organizational wide teams to be running quality improvement projects relating to these specific areas. They can then capture all of their learning at that localized level in a quality improvement project, as we see here. We can see which area they're trying to do it in, what their problem is, what they're trying to achieve. But also something that's really good, I know is really important within PSIRF, is actually tracking that service user involvement and really understanding how you've been kind of communicating with those people that were affected by this incident. So what we can do here is on this section down here, we can add in our service user involvement. Now we do have two kind of generic types, which is the big I and the little I, but we have the ability to add in detailed notes to each project here. So as I mentioned, this is a really good way for you to be able to document exactly how you have been communicating with the people and what you've done for those people that have been affected by this incident. Now, it's also worth noting that these are reportable fields. So one of the things is you want to be able to understand exactly what's happening within these priority areas. You want to be able to document how you're engaging with these people, how you're engaging with your stakeholders. So you can pull these through to reports and to your dashboards. So it's a really good way of having that overarching view of exactly what you are doing. So within the individual project, obviously they can run their own driver diagrams of what they are trying to achieve within this project. They then have the ability to add in their measures and charts so we can see if there is a kind of overall improvement within this specific project. We also can run our PDSAs, so they can run their tests of change and we can run reports and all of this. So we can be documenting exactly the lessons we've learned, how we have tried to change these, and then what's happened, what are the outcomes of those changes. So it's just a really good way for you to be able to have everything together. So for example, here we could document our overarching number of falls within Usher Ward. We'll then be able to track over time whether we are seeing improvement or whether we're not seeing improvement. I'll just jump on the PDSA so you can have a look quickly. So here we can see that, they're running PDSAs around improved education and awareness among staff. And then this is something as well that we want the right stakeholders to be able to see the information. And we also want to encourage learning across everywhere. So that's one thing that LifeQI is really good for, is that visibility across your organisation and across your staff. You're able to search for projects that are similar. You're able to learn from each other. And if, for example, this project here within Usher Ward has been doing a really good PDSA and they're really starting to see improvement, this is then something that you could take and you could implement within other areas of your organisation. So just coming back to my project here. The other thing is we can create kind of bespoke report templates in LifeQI. Now, it might be that you want to report on specific things relating to your PSIRF work within an individual project or as a whole. So we have the ability to set up different report templates, which you can then run from different areas, and that then can become part of your portfolio and can evidence the learnings and the work that you're doing based on your priorities and based on your patient safety incident response profile. So it's a really good way to document, pull off, and then you can keep it all together. The other thing with LifeQI is that we want all the stakeholders involved. Now, as it is an online software, we can have people access it from anywhere as long as they have internet. So you can ensure that all the right people are in the right place, seeing the right information. Another thing that is important from my understanding with the PSIRF is being able to report on the 4 key aims and being able to understand what is linked to what and how that, that spread is across your organization. So we do have the ability to set up specific tags as well. Now, tags are used as a way kind of to organize and categorize your work, but they are also reportable. So you can think about setting up different tags relating to those 4 key aims and link these to specific projects. But you can also link them to your overarching program. You can then draw a report based on those individual 4 aims or as a whole, and then be able to see what information is relating to which of those 4 key aims and report to the people that you need to. So apart from being able to obviously run the individual quality improvement projects relating to these priority areas, these patient safety incidents, and being able to track and manage how you're going to implement the framework across your organization and have sight on all of that, we can also, coming back to my overarching program here, oh, sorry, taking a second to load. One of the areas on our change idea was thinking about kind of having these as organizational wide learning as well. So not only do we want to drive these within our local improvement, we want to be able to drive these within our organization wide improvement. We're really pushing for kind of that change and that embedding the improvement across the whole organization. So another way that we can utilize LifeQI in relation to kind of our patient safety priority incidents that we have highlighted, we can also run collaboratives. Now, these are your organizational wide improvement projects. Now, the way that a collaborative differs is we are actually able to include lots of different localized areas, so different wards, different directorates, different, whatever that, different services, whatever it might be, but you're all working together to improve that one priority area. So let me just jump over and show you an example. So this would be my organization-wide improvement for my priority of pressure ulcer reduction. What we can do here is we can have lots of different areas working towards that shared aim. They're then able to implement changes in their own specific areas, track how they're doing individually, but we have the added bonus of being able to draw that data up and see that aggregate of how we're doing as a whole across our organization. So let me just jump in and show you what I mean. Now, while that's loading, I'm just going to take a breath because I've thrown lots of information at you and just check in and see if we had any questions as of yet.
Hello, Sophie. No, we're all good for questions at the moment. Thank you. You're doing a good job.
Perfect. Excuse me if you can hear my dog barking in the background. I do apologise. The joys of working from home, you get distractions. But anyway, so yes, as I mentioned, so as part of kind of this overarching collaborative, we can run these across our organization. And then what we're able to do is we're able to get that automatic pull up of data for each of these individual localized areas. So we can then be tracking exactly how we're doing at each level. So example, I've got my kind of Bay Health team, Pioneer team. This could be Ward A, Ward B, whatever, however you want to structure it. We can see how they're doing at that localized level, but we can also then track how we're doing as a whole. So you can see here how this is really helping you go towards that data-driven approach of reporting on and understanding your patient safety incidents. We don't just need to use it to kind of have those localized projects. We can really start to drill down and have that cultural approach of driving improvement across our organization. As you can see here, if we wanted to, we could drill down on each individual area, see how they're doing within the specific wards, and then we can also see here our aggregate. It's a bit of a crazy aggregate chart, but how we're doing as a whole there. Another way that we can kind of utilize LifeQI to help document our work relating to PSIRF is the ability to kind of house and group information within one place. So what we can do is we can create groups in LifeQI. Now we could have a group for each priority area we have highlighted here within our safety incident response kind of profile. So what are the key areas we're working on? Where do we want to drive change and what do we need to be documenting? We can then create a group for each of these. Then any individual quality improvement project that's happening within your organization can be linked as a member to that group. Now that benefits us in multiple ways. The first way is that we can then report off that in a dashboard. So we could create a dashboard for all of your quality improvement projects relating to patient safety incidents. Okay, that could be across all of the priorities, or we could drill down and do that as kind of separate priorities. At a glance, we're really easily able to access our information, see how many active projects we have relating to a specific priority or in general, or all of our patient safety incidents. We're able to understand how many we have kind of showing improvement and how many are really driving that change within the organization. We can also, as I mentioned earlier, we can also report on how many projects we have relating to that service user involvement. And that is quite an important part of PSIRF, is really being able to understand how these people are involved. at the bottom here, we have a really nice kind of project summary report. Now, just going back to kind of what I said earlier, as you can see here, we have the reportable fields I spoke about. So we can see here quite easily that my reducing pressure soils project here has got this service user involvement and then what those service user involvement notes are. We can report on those tags, so we would be able to see at a glance kind of which of those 4 key aims it's relating to. And also by having a dashboard, we can save that as a report and we can PDF it and we can send it to people that we might need to share that information with. I can see that my sound's still not coming through very well. If I move my microphone, is that any better? Might be because I'm moving around a bit. I'll try and stay still. I'm used to moving when I talk, but let me know if that's any better. Jason, is that coming through any clearer for you?
Yeah, it's been fine for me. There's the odd pause, but I think that's just you taking a breath. But
Okay.
a few people might be having some local bandwidth
Okay.
issues, maybe.
No problem. So this is one way that we can use kind of the groups to house lots of projects relating to those patient safety incidents, and then you be able to access quickly and report on. Then within here, all of these kind of counts, I say they're clickable. Never know if that's a word, but we go with it anyway. But you can actually click on these numbers here, and it will take you through to an already filtered list of the projects that are relevant to that specific area that we have the dashboard, whether that's one of your key priority areas or whether that's your total patient safety incident QI projects as a whole. We can also then, from these project lists, pull off the project list reports. And as I mentioned earlier, we can absolutely make bespoke report templates for you. And we could set these up based on the key information that you need relating to your PSIRF framework. So what is it that you need to see from those projects that's important to you? You can then run that project list report across all of your projects and have that information at hand and take that off LifeQI if you need to. So just another example of a type of dashboard that we can create for you here. So this one is looking at all of our different priorities in one dashboard. We can see here my first priority is my pressure ulcers. I then have a lovely little table of which projects I have relating to that project, what their progress score is, what they're aiming to do. And then we could add in the more reportable options if we wanted, like those tags and those service user involvement notes. And we could have them for all of your priorities on one dashboard. So I'm just going to come back here. So hopefully you can see that there are lots of different ways in which LifeQI can support you within your work relating to PSIRF, whether that is tracking how you're going to implement it. So going back to the program at the beginning, identifying those priority areas, how are you going to roll those priority areas out within those individual projects, really getting into the nitty gritty of, right, well, we know this is a priority area. How are we going to do this? How are we then going to roll this out to the organization? And then being able to track those individual localized projects relating to those areas. I'm going to take a breath there because I've been talking at you for about half an hour straight and I'm just going to see if we've kind of open it up a little minute and see if anyone's got any questions, anything they were hoping to kind of get from today, anything that wasn't clear or anything that we can go over at all.
Just while we're getting a few questions perhaps pop in, there was one that came in earlier on the Q&A, which I've answered, people might have seen, but just in case they haven't, someone asked, is there any limit on the number of tags that you can create? So no, there is no limit on that. You can create as many as you need and kind of add as many tags as required to any individual project. That answers that one, and I can share a link in a minute as to how you go about creating tags, a link to a help article on that. I've also just had something come in the chat. Shows again how we can see ward related data and how each ward is doing.
Yeah,
We could probably go
absolutely.
back to
Yeah,
there. Thank you.
100%. So there's different ways. It depends if we're looking at just one project for that individual area. So it might be that a ward has run their own project on pressure ulcers or falls, as an example, and you'd be able to find that through their individual kind of quality improvement project. But if we're trying to track it all across the organization, that's where we would use that program functionality. So let me come back to my program here. So this is looking at my Bay Health kind of pressure ulcer reduction collaborative. So I've set up a collaborative program in LifeQI, and I have multiple wards or multiple teams linked to this program. We're all working towards the same aim, and we're all tracking the same measurement strategy. So all of my wards have that same outcome measure of the total number of pressure ulcers within their ward. Now, the way that you'd be able to track individual and aggregate would be through the measures and charts section here on the program, okay? Now, within here, you're going to have a list of all of your measures. I can come into any one of these measures, and within here, I will have a list of all of my individual project charts, which would be my wards. So for example, this might be Pioneer Ward. I can open that up and I can see, okay, how's Pioneer Ward doing against this priority? And I can check their individual data. And I'd be able to scroll through, and I've got the really nice spark lines there as well, which are really helpful to quickly and easily compare how each site is doing. And then you would just go through and you could then have a look at all of their individual charts here. And you can see that we've got a nice shift within our data here. And then at the bottom is where you would see your aggregate. So where you would see how you're doing towards that priority as a whole organization. Okay. I hope that helped answer your question, but do let me know if not. I can see that someone's got their hand up. If you'd like to just pop your question in the chat, because I'm not sure we can unmute you on the webinar, but pop it in the chat and I'll be more than happy to help. But any other questions come through, Jason?
Yeah, so the person with a hand up has come into the Q&A as well. It's related to what you've just been showing around multiple pieces of measurement data. Will this show us one data on a page for reporting purposes? So I think as Sophie's just been demonstrating in terms of how it's displayed in the system, you've got essentially this page here, the individual charts at the top, and then the aggregate at the bottom. In terms of other forms of reporting, getting that data out, if you were to run a report, so something that you could download as a PDF, you could choose to share or include in each of the individual charts kind of on the page or over several pages, depending on how many charts you've got. But yeah, in the system, this is how it's displayed, as you can see on the screen here at the moment.
Yeah.
Hopefully that answers that one.
Another one that I like to point out when we're running kind of collaboratives as well is that you do have the ability to do what I call a data dump. So this is a really good way to regularly kind of pull off all of the data across all of the measures and all of the projects within the program itself. Now, I know some people like to do that on a regular basis, and it's quite easy. On your kind of overarching program here, there's this actions button. From here, you can export project measure data. So if you wanted to pull all of that information, all of that data off across all of your wards into a CSV, which you could save as an Excel, you absolutely can do that through that functionality there. So that might just give you another way of thinking about how you would access that data.
Great,
Hope that helps. No problem.
Yeah. There's another couple of questions. So we've had one come in asking about who can create the dashboards for groups related to priority work, which I guess I can answer. So anyone within the organization can create groups. So you don't need to be an admin user to create those. Creating the dashboards is a bit more complicated, and that will be something that either your admin or guru users do, or you may work with us to create those dashboards, just because it's a little bit more complicated. But but your users do have access to the functionality required to do that. And yeah, so either you or we could do that. Unless you got anything to add on that one, Sophie?
Nope, no.
Cool. And then another question. So how do you close off tags when you've achieved your goal?
So I have a recommendation. So this is becoming more of a conversation with kind of different organizations and different trusts, and you can't really close off a tag, if you will. We can't kind of go, yeah, our goal's been reached, let's kind of tick that off. But what you could do is a way around that is you could actually create a new tag saying, you know, this one has kind of been achieved, and then you can report on that. Or you could change the name of the tag to say achieved, and then you'd be able to report on that. So technically you can't really close anything off, but we could amend it to say goal achieved and then be able to report on that. So I'm not sure if that's exactly what you're looking for, but just an idea and a way that we could kind of help with that closing off.
Well, thank you. Another one just come in there. Can you repeat the first bit about how to set it up initially, please? I don't know whether that relates to kind of the program or the tags.
Yeah, if you could let me know which bit specifically, I'm absolutely more than happy to go over that for you. Program. Okay. So in order to kind of create the program, you would come to your programs area on the left-hand side navigation bar here. And in the same way that you'd start a project, you're just going to click Start a New Program, and you're then going to be able to add in kind of your title and your aim for that program. Once we've kind of created the program, there's a little bit of kind of setup to do in order to get those measures to the right place. But let me just do this. So we would go, and then we'd add our aim in here. In the same way we do on a project, kind of add who's helping us run this program, our start date and our end date. And we would then have the bare bones of our program. Now, as I was just saying, there's a few kind of things that we would need to do in order to get those measures to the teams and set those teams up. But Jason can share a couple of help articles within the chat around setting up programs. But also, please do reach out to either myself or your success manager within LifeQI if you would like to set up a program to track any of this kind of work, and we would be more than happy to work with you and kind of give you a little bit more guidance on how you would set that up and how you would flow those measures down to the teams. Okay, perfect, no problem. Okay, any other questions for us at all?
I suppose I've got a question. So if you just sort of throw into the mix, something that's occurred to me during the course of this is you've obviously been talking about how to use this sort of functionality to support PSIRF work, but could the same kind of approach be taken, the same functionality be used to support other sorts of work, kind of documenting, managing other sorts of work within LifeQI? Some of the examples I've heard about before are people wanting to record projects that relate to different CQC domains, for example, or things that are associated with a CQC action plan, for example. Is there any reason why we couldn't use the same techniques, tags, groups, dashboards to manage that kind of work?
No, absolutely not. And that's a really good question. You know, this is very much kind of, as Jason mentioned, focusing on the PSIRF element, but absolutely, we can utilize anything that we've just looked at to report on any type of work, whether that is your CQC domains, whether that's anything that it might be. We can absolutely utilize that group functionality in those dashboards and the tags. And, you know, you can use this functionality in the way that you see fit for the areas that are important to you that you need to be able to report on. And also, it's not to say you can only do it for one. You know, I'm not saying, right, you can only do CQC domains or you can do it to capture your PSIRF work. You can use this on all of those. If this is a really good way to track and manage work for key priority areas, for individual themes, you can absolutely run multiple using this functionality in LifeQI.
Excellent. It's good to know.
Perfect. Okay. So I've just saw a question come in around kind of projects before you start the program. Absolutely, you can add projects retrospectively into LifeQI. You would just be able to create that project and then bring over that information, kind of copy and paste that information over. So you then have a documentation of all of the projects, whether they were old or the new ones coming up relating to that specific piece of work. So yes, absolutely. Okay. Now, one thing I did forget to mention earlier, so I am really quickly going to just show you, and then I will let you all get some time back in your day to probably go and cool off. Don't know about you all, but I need to go and cool off. But one of the things I wanted to speak about was kind of managing those ongoing safety actions as well, kind of relating to specific areas. So one really good piece of functionality that we have is within our kind of PDSA area, we do have the ability to create tasks and track tasks and assign those to people within that project. So I've just come into my PDSA here within my falls reduction on Usher Ward and my task area here. You do have here, I can build out tasks. Now, I know they're as tasks, but we can have these as kind of, you know, your ongoing safety actions. So what are those safety action tasks that we need to achieve relating to this project? Have they been achieved yet? When do they need to be achieved? Who is leading on that? So that's just another thing that I wanted to highlight because I thought that would be a really good thing to show as another way to help document this work. But I really hope that was helpful and has given you all a bit of food for thought. This webinar will be recorded and will be sent out to you after. I believe it's normally sent out within 24 hours, but Jason, correct me if I'm wrong. But you absolutely will all get a recording of this. If you have any further questions, if anything has kind of piqued your interest and you really would like to think about how you can use it and how you can start setting some of this up, as I mentioned, please reach out to us and we'll be more than happy to help. But yeah, thank you for listening to me talk for 40 minutes. It was great to have you all on. Enjoy the rest of your day and yeah, stay cool. Thanks so much, everybody.
Yeah, I think the recording will probably be out within the next 48 hours. And yeah, do get in touch, help@lifeqisystem.com if you've got any questions and need any help, just come in on that email. Thank you.
Perfect. Thanks so much, everyone. Take care.
Cheers. Bye-bye.
Bye.